The reality is when you look at programs like the non-operative weight loss programs like Weight Watchers and Nutrisystem, may work really well for patients who need to lose 20 or 30 pounds. But when you've hit that part where you have a BMI of 35 or 40 and suffer from serious medical issues, the reality is the success rates for long-term weight loss in that population with a non-operative weight loss program is less than 5%. Whereas we can offer a patient a tool, and this still work for them, but a tool that will allow them to achieve at least a 90% success rate. 90% of our patients will keep at least 50% of their excess weight off. It's not easy. It's not the easy way out. These patients have to work hard. We're going to work hard with them. But what we want to do is make sure that they get the right operation for them. And for some people, if they need more of a behavior modification to really be successful, the bypass may be the best operation. If people need maybe just a little bit more restriction and not so much behavior changes, a laparoscopic gastric sleeve may be the best option. And if a patient truly just wants an outpatient procedure, we can do a lap band as an outpatient procedure and allow them to get back to normal activities, oftentimes within a few days of surgery. What's really been gratifying is when working with these patients is not only do we help these people lose weight and they feel better and they're able to play with their kids and grandkids and do all the things they want to do in life, but 80% of our patients who have type 2 diabetes are able to get off all of their medications within a year of surgery. 50% of the patients who we see who have high blood pressure are able to get off those medications within a year of surgery. And 90% of patients who have sleep apnea, who have to use CPAP machines, are able to get rid of those machines within a year of surgery. 90% of patients who have gastroesophageal reflux disease are off those medications within a few months of surgery. And so the health benefits that we see, it's so fun to be able to see these patients not only feel better, look better, live better, but they're able to get off their medications, and we know that they're going to have a healthier life as a result of it. I think, when a patient comes in here, I think they're going to be pleasantly surprised at, one, how caring we are, and two, how much information they'll get. And there's no pressure to have an operation. We want people to come in here and learn about the process. And we offer a seminar where we'll explain all the different operations, explain, the preoperative assessment, the postoperative care, help them understand all of the different surgical options so they really feel comfortable about what they may or may not want to get themselves into. Nothing has been more rewarding than this, because this is like curing cancer for each individual. I mean, in the thousands and thousands of surgeries that I've done, I haven't had a patient yet who said they wouldn't do this over again. But they almost all say, I wish I would have done it a little bit earlier. But we see such a transformation in people's lives. I mean, we literally are taking people who they're suffering. I mean, they're suffering in society, but they're suffering physically, they're suffering mentally. And these are tough problems to be that overweight. And when we can help that person get to their goal, to lead a more active life, a healthier life, to be able to get rid of the medications that are one, costing them a lot of money, and two, really, you don't feel as well. And to be able to help those people get off their medications and lead a healthier life, it's like curing cancer.